Hey everybody.
Hey everybody, I love you guys.
Yes. Anyways, I was gonna do a video on
The one that's not picking up our time.
I was going to talk about Medicaid and Medicare. So those different policies that have been going on these are government assistance programs.
One is not picking up all times.
So with
And one is not picking up.
Social Security and Medicare. Now, there have been a lot of changes since Donald Trump has been president, and I had really witnessed this myself when I had to go to apply for my mom's Medicaid. Now, when you go and talk to an agent about health insurance, it's important to gather all your documents. Now, I have pretty much, from my mom's insurance to my dad's insurance. My dad had United Healthcare too as well. A lot of people claim that Humana is a great insurance company. There are good and bad things about health insurance companies. Now, United Healthcare, I'd show you. This is ridiculous. The amount of bills that United Healthcare has been sending to my mom. So this is not even all of her bills. They say it's not a bill, but it's basically the healthcare provider is billed to the insurance company, and they take out the out-of-pocket expenses, and it's incredibly crazy about how many bills that she's gotten from United Healthcare. Okay, so this is a claim summary. So when you look at this, you want to really look and see, because it will tell you the dollar amount that the healthcare provider will pay for. Now, this is $5,735. Your plan paid $235, and then the total amount you owe to the provider. So this is a portion of the payment that goes to United Healthcare, which is $2,631.51. So, as you can tell, United Healthcare has been around for a while. The reason why I chose United Healthcare out of all the plans was because United Healthcare has been in business for such a long time now. So here's another thing and you want to look for the claims department, because the claims department will show you if you've been billed wrongly. Louisiana Department of Insurance. And then they have the address, the phone number, and if you want to continue services, then you can request those. It also tells you what rights you have. You must send this complaint within 60 days. If you disagree with this decision, you have 15 days to really file your complaint. And you can file that complaint with the U.S. Department of Health and Human Services, because that is the government office that it is. And like I said, you really want to make sure, because a lot of times when insurance companies, they bill these health insurance, they bill the physician, and the physician gets back basically the insurance, the person who is the patient normally gets billed, and then the doctor has to look and see, like, out of that cost of what the portion of what they get paid for. Okay, so like I said again, it is very important that we address these problems, because a lot of people have problems with health insurance companies. I've already listened to what the politicians they have talked about with insurance companies, and of course Donald Trump when he talked about cutting Medicare, cutting Social Security, retirement benefits, and so on. So when I had found this out, I knew that there had to be some kind of person, case manager, whatever they have, they should be able to have somebody on staff to tell that person, the patient, how much do they owe. And also keep in mind that if you can't afford for your hospital visits and stuff, Ochsner has a financial assistance program, and you want to contact that the billing department as soon as you can, because a lot of times when even my mom still has bills piling up from Tulane University, no, not Tulane University, Tulane Hospital. So you want to really look and see like what exactly is the doctor billing, like what exactly are you paying out, the co-insurance, all that, and how you have to meet the deductible. Now, every deductible and every plan is going to look different. Luckily, when I got this insurance from my mom, I knew that she needed a good specialist. She needed somebody who was going to help her with her care. I still am looking for a case manager because case managers handle every paperwork. God forbid all this paperwork, okay?
Baba.
And it is very important that when you get this paperwork, that you go over it, okay? And what I mean by this, okay, I should have highlighted this and stuff. But anyways, this right here, this paper right here shows you the account information plus the remaining balance and the deductible and what is ever made out of pocket, meaning how much money are you paying for your visit, okay? Because a lot of times we get so wrapped around saying that, hey, I went to the hospital, I came out of the hospital, who's going to be able to pay for my medical bill, especially senior citizens. Now, when I noticed that United Healthcare was paying for a majority of my mom's, like I said, behavioral health was so expensive, okay? Because these big health insurance companies, they all come from different aspects, like you really got to stay on these insurance companies, because if you don't, it will continually keep on building more momentum. You're going to have more things that are coming up with the hospitals and clinics. Now, if the doctor is billing you, and I'll give an example, $900, and they tell you that you must pay them, and if you don't, then that would mean that you're going to have to pay even more the next time you see a doctor. Because a lot of times people, we get in a debt because we don't even realize or look to see if who is covered by what. And when you talk to these people, because I hate talking to debt collectors. We all have them. So, if you are dealing with a debt collector, remember that you have your rights, just like patients have their rights, and whether you know about these rights or not. Because a lot of times people don't know their rights when they are dealing with healthcare. This healthcare industry has been complex, especially Medicare policies. It's very, very complex, and by the time you hit a certain age, it's like they want to hit you with the insurance, and then they want to talk like Medicaid is the state insurance. Medicare is basically the federal insurance. So that is a nationwide type of thing. And when you're dealing with this crap, you got to have somebody to advocate for you, especially if you're a person with disability. Okay, it would be different if you didn't have a disability, you don't have your limitations. You can come up to the Social Security office, talk to that person, and they should be able to straighten things out for you. But long story short, a lot of time people don't realize this when they go into these hospitals and then they get charged for X amount of dollars. They just, straightforwardly, they hand you a bill and then they call you on your day out and they never see you again, kind of thing. So before you dive into all that craziness, realize that you are paying for your health care. So really big thing, keep track of the things that you have so that by the time you really need help, you go and talk to the financial assistance program. Now, this is a big burden on the U.S. American people who have really dealt with a lot of debt over the years. So, like I said, make sure that you clearly address those as they are so that you don't end up in more of a burden on yourself or a burden that you leave when you go to a doctor's office. Because I know a lot of people just get so upset about this, they don't even want to deal with anybody because it gives them a headache, and nobody has time for all that. But anyways, yeah, I hope you guys enjoyed this video. I will create more YouTube content. Now, do not forget my next coming up video, you will see a lot of great information about a credit repair business. I really didn't want to hold that off for very long because I knew this is a great business to be a part of. And there's going to be a lot of great live coaching calls and things that can really help build your income.